So Nat, I've known you for a long time. We grew up kind of in the same neighborhood as little kids. I knew your brother. We were in the same grade, and you were a couple years younger than us, but we have a lot of history.
Yes.
So it was interesting getting connected with you when I moved here to Las Vegas, knowing that you were here. So that was awesome. And then we had no idea that we kind of had this crossover.
There's a big crossover.
Yeah. So we both help employer groups in different ways. I obviously I'm a healthcare and benefits consultant. You work in commercial real estate, and then so Doug, I don't know if you know this, but we were on a call the other night. And we were just kind of chatting back and forth, and she's like, "Well, what do you do?" I was like, "Well, I help employers save money on healthcare." She goes, "That's interesting. I do the same thing in commercial real estate." And she goes, "Commercial real estate is actually, that's one of their biggest overheads for any company. Is
It's their second highest line item.
Yeah.
Yeah.
And I was like, that's interesting because healthcare and benefits is usually their second or third line item on their P&L.
Yeah.
So we're in the same business. We help employers save money so that we can sustain a better economy and better growth, right?
Yep, exactly.
That's kind of the bottom line.
Yeah.
The dynamic's incredible. So you and I started talking about how can we come together and help employers collectively.
Yeah.
And so
there's more things in common than that. So when people hear real estate, their eyes roll back, right? We hear real estate, we immediately, oh my God, who else can I talk to in the room? And when people hear benefits or insurance, they run from you, right? And so how do we have conversations and bring people in to help them understand we are here to be a resource? Whether you use us or not, there's a lack of education. You're overpaying. It's your second highest line item. So if you're coming to our market and you're taking down office space and you're not using somebody that's qualified, you're overpaying. And guess what? You're gonna leave the market. You're going to overpay. You're gonna go out of business. If you're not using somebody like Danny and you don't have somebody like Danny at your fingertips that you can call and ask questions to, you're gonna overpay. Because guess what? Somebody like Danny doesn't have a resource like Doug. The stories that you told me at lunch blew my mind. Are they secrets?
No, we can
Can
talk
you
about
tell that story?
Yeah, so just one of the arrows in our quiver.
Kind of like the shoulder one.
Yeah, I'm talking about
That was the money.
high cost care and surgery,
Yeah.
right? Those are the biggest hits to a health plan, is the big stuff. Birth, surgery, cancer, end stage renal disease and dialysis, things. Those are the biggest hits to a health plan.
Yeah.
So that's kind of what we focus on. One of those things being surgery. Doug is a huge partner of ours in that. So we were able to get a plan member from down in the Northwest, from up in the Northwest down here to Las Vegas for a shoulder surgery, where the provider up there in their local market was going to charge them about $45,000 for this surgery. I contacted Doug and I said, Doug, can you help my health plan and this plan member get to a better place for low cost, high quality service? We got the same surgery for $11,000.
Okay, so let's break it down though, because I'm guessing that most people are like me, let's be honest. So your client in the Northwest called you here in Vegas and said, hey, this is gonna cost me $45,000, which when I hear that, okay, fine, to quote the Tiger King, I'm never gonna financially recover from this. And you called your resource that happens to be here in Southern Nevada as well. You called your contacts, which are surgeons here locally.
Exactly.
And you were able to get the cost to $11,000.
So I work with high-performing surgeons. So these are guys that are in their upper 10, 15 percentile of their practice, and they own their own ambulatory surgery centers. So the first thing is getting the case to a lower cost environment. And many times it's just moving it from a hospital to an ambulatory surgery center. And the folks that I work with, they also know the pricing model. So they know how to come up with what's called a bundled price. So it's one single price for the entire episode of care, as where if you go into a hospital, you've got a facility fee, you've got a surgeon fee, an anesthesia fee, an implant fee, and you get billed 6 months later that you go, what is this? As where this, it's one price, it comes with a warranty, so you know you're gonna get a good quality outcome, and it's open pricing.
And then from my point of view, I'm thinking as somebody that's in this community, now that person and that company and that family in the Northwest knows that Nevada can be their resource for medical care, which I'm sorry, I didn't think that was a thing. So they came here They stayed in our hotels. They saw our doctors. That blows my mind. I didn't know that that was a thing. Crazy.
And we can even build health plans like that here locally. No, so people don't have to come from Oregon or Washington. That can exist here within this own ecosystem of Las
Yeah.
Vegas. So rather than purchasing insurance from a carrier, we build the health plan ourselves, which is around healthcare services. All of those dollars stay here in the community. So you're not paying a carrier and sending those dollars to Wall Street. Those dollars are staying on Main Street. So let me ask you a question. When is the last time you went to Geico or Progressive to buy a vehicle?
Never.
You don't buy your car at Geico or Progressive?
No,
They sell auto insurance, right?
they do.
Yeah, they don't sell cars.
That's correct.
So why would you go to an insurance company to buy health care?
Oh.
Doesn't make any sense, does it?
No, it doesn't.
So we build
Yeah.
actual health plans. We're not selling insurance
Yeah.
and paying premium and sending money out of state. We're keeping those dollars here and building the health plan locally.
Okay, I really like that. So I am obviously in commercial real estate, and so I have a ton of companies that come here from out of state. I represent entrepreneurs, startups all the time. And so I have never thought ever to refer them to anybody that does what you do. Not my lane, to be honest, even like some of the terms you use, I want to run out of the room because it's like the connotation is there, just like with real estate. So let's say
It's boring, it's not sexy.
it's not that it's boring, but it's like it just has such a negative connotation. Just like people with me, it's like salesman, car salesman, car. So, but I love what you're saying, and I love the fact that I think people come here and we're all in silos. And so how do we all work together? And that's what Nevada is known for. These companies come here and we're all in silos. We were talking about that at lunch. You mentioned in healthcare, nothing to do with what I do, but we're all in silos. So how do we all work together? And it's the highest line items.
Right.
It's ridiculous that I don't know what you do. You don't know what I do. And that's why we had that conversation. Yeah, we grew up together. My big brothers, you guys used to torture me when I was a
Yeah.
kid. So I'm gonna bring up some embarrassing facts, so make sure that you stay tuned into this video.